Hello again, everybody. This is John and Glenn with BestPriceNutrition.com. Today we're going to talk to you guys about the Saffron Saffron Chews from Rebody. We've had a lot of questions about them. We recently did a video on the capsules, which is actually the same ingredient. This is a chew form. So some people may have missed that, and some of you were getting a lot of questions coming in about this product, are just searching for chews. So we did another video on it. And the chews is a chewable version of the Saffron. The Satoriel, or Saterial, depending on how you want to say it, it's a trademark name. And that's the one that's the blend of the saffron extract that's actually all the research has been done on, so that's why we're referring to it that way. And Glenn, what is saffron itself?
Saffron's a plant. Many of you may have heard of saffron spice in spice shops and things like that. Very expensive because it takes around 75,000 saffron blossoms to produce a single pound of saffron, so it's kind of expensive.
It's all done by hand as well, so
yeah.
I think that contributes to the cost. So even as a spice, it's pretty expensive, and now in the supplement form, it's kind of taken wave because Dr. Oz has spoken about it on his show a couple times now, and really that seems to really drive up demand. So we get a lot of questions, so that's why we're doing this video. We have a list of questions here, so we're going to try and answer them. But first, we're going to tell you a little bit about it. I mean, the history of it, it has been used in Persian medicine for centuries. We don't really concern ourselves with that kind of stuff. We're really looking for human evidence. We will look at some of the research on rodents just to see preliminarily what it is and translate that information to you guys. But really what we like is human evidence if you've not seen our videos before, and we look to make sure the studies are designed correctly. So really, Glenn, when we're talking about it, what does it do? What does saffron do?
It can basically help increase serotonin in the body. It helps with curbing the appetite, I guess. That's the main thing, appetite control. The basis behind it is that there was a study that found that neurochemical processes they're behind compulsive eating are also the same as drug addiction. So it led them to believe that these same processes behind drug addiction are behind compulsive eating.
So people who can't control eating, it basically is related to some people carry a gene, or some people may just have lower levels of serotonin. So typically that's called depression, and in layman's terms. And with the brain, we're always learning so much, and it's not always the easiest thing to diagnose. I think depression is by a set of criteria. There's not always a blood test that'll say, hey, this is exactly what's wrong. So the idea is that the way antidepressants work, most of them, these are SSRIs, which are selective serotonin reuptake inhibitors. What that does is your body releases serotonin from the presynaptic cleft from a neuron, and then there's serotonin left in the synaptic cleft to be absorbed on the other side by the postsynaptic cleft. Well, what happens is that serotonin that doesn't get absorbed, it's going to get reabsorbed on the other side, on the presynaptic cleft. And if you can block that reabsorption, you'll leave more serotonin to be absorbed in the synaptic cleft. So basically what it means is that you get more serotonin absorbed, which means that you're happier. It tends to affect your mood. And they actually had some interesting research where they compared it to Prozac, and they were actually able to conclude from some of these studies that it can be used to treat mild to moderate depression in humans. That was pretty interesting to see that.
Yeah, and a lot of the problem with Prozac and SSRIs and things like that is that, like John had said, it leaves that serotonin in the synaptic cleft there. Your body then gets this influx of serotonin, you can feel good. Well, if you come off of those, your body's not very good at releasing extra serotonin anymore because it's always had the extra in there.
Yeah, then you're going to get the downregulation.
Yeah, the downregulation there. So that's why for many people that take those, they have to stay on them. So this may offer an alternative, if you go by the research, to that.
Yeah, like Glenn said, antidepressants are really not something to play with. It's not something you go on for a short time and say, oh, I'm going to get off of them. Because most of them are associated with, side effects where, there's depression, it's, people have the inability to be happy, and they can have suicidal thoughts. You don't just recover overnight because your body then becomes adapted to having more serotonin in that synaptic cleft, so then your body's just not as sensitive to it. So then you go off, and all of a sudden the reabsorption is not being blocked. So that really, really is a problem. So it's kind of interesting to see that there's a supplement out there that doesn't have those side effects. There is some pretty interesting human evidence out there that says that it may be able to help. And ultimately, the reason why we talk about these mechanisms so much is that's really what's leading to them being able to say, hey, we did research and we found that it helped people curb appetite, and it's based on these mechanisms of action. So it's pretty interesting. I would like to see more research. We're always fans of seeing more human evidence, well-designed studies, but it's very promising, And if you are somebody who's thinking about going the route of an antidepressant, it certainly would be a nice mid-step before you try and go down that road. That's for sure. You know, or at least talk it out or what have you. But again, this is more related to appetite control, and that's what they're going for. We're just mentioning this mechanism of action now. We get a lot of questions, Glenn. Can it be taken with other stuff, other supplements?
Yes, it can. It's not a stimulant. Doesn't have any stimulating properties, so it can be taken with other.
Other questions are, you know, can you take it on medications? You know, with that, we're not physicians. We're not, you know, advocated to say that. We can tell you is that we don't see any side effects that have come up in any of the research, but it's always good to double check, you know, with your physician. So, as Glenn said, it's non-stimulant. Take while breastfeeding. Can you take it while pregnant? There's nothing that says that you can, but again, it's always good to double check and make sure your doctor actually knows what it is. Sometimes they probably won't know, so make sure you inform them. There's plenty of research on PubMed that you'd actually find on it. That's going to be a good place to look. Glenn, how many milligrams is in this one?
There's 88.5 milligram per one chew, and there's 30 chews in each container.
And that's the same dose that was recommended and what the research
yes,
has
in all
shown.
the research, exactly.
Okay, and that was what I believe they talked about on the Dr. Oz show. That's another big question we
get.
get.
The important thing is that it's the cereal version of the Saffron, and then it's 88.5 milligrams, which this product is.
And they ask when people should take it. That's another question we get.
You generally take it between meals. A good time that I recommend that people take is between breakfast and lunch, and then between lunch and dinner.
Okay, yeah, or whatever your eating schedule
whatever
is.
Eating schedule is.
And it is the same as the pills. This is just a chewable form. Glenn's actually going to open them and try one. Kind of
the difference too, though, is this only has 30 chews inside.
It's half
of it,
the amount.
So it's half the amount. So if you were looking for, well, let's say a full month supply with taking 2 per day, you'd have to buy 2 containers. Whereas with the pills, it's 60 capsules.
Sure. And some people may associate the chewing with it being a little more satiating because it mimics eating. Now some people may say, hey, that might make me go down the road to want to eat. So that's really going to be a preference. How does it taste? You know what? We haven't tasted and flavor, so you're going to see a genuine reaction here. You see it's pretty small. It's about the size of a Starburst, I guess, if you can imagine, but for rectangular. What is the flavor on these supposed to be?
It's supposed to be mandarin orange.
Mandarin orange, right. Well, we'll be honest with you right now. Oh, it's actually pretty good.
Yeah.
Problem is I might eat the whole thing.
Yeah.
I'm just kidding. Yeah. Let's put it, I'm going to taste like orange.
Tastes like candy, yeah.
Yeah. So
don't eat the whole bag at once, but
yeah,
it's good.
Yeah. Other questions that we get, let's see, how long will one package last? Well, as Glenn said, you know, it can be 1 a day, 2 a day. I think generally they're recommending 2 per day.
Yeah.
So that you get 88.5 milligrams twice per day. So the capsule, the 60 capsule bottle that we have, that would last you a full month. That would be half a month. Maybe you use both. I know we have a package on the site where you could buy both for a discount.
And the advantage of that is that maybe you do have that craving for a sugary candy or something like this. You're getting the benefits of the Saffron with that.
Sure. And how long can you take it for? You know, there's nothing that's another reason why more research needs to be done for a longer term, so we can make sure the effects continue. Based on what they've shown so far, there is no down regulation or anything like that, so it seems you could take it for a longer period of time. Generally, if you don't know, I think it's a safe rule of thumb to say 12 weeks. Yeah. Give yourself at least half that amount of time off. That's not essential. It's just based on a lack of evidence. We can only go off the information that we have in front of us. Being that it's a non-stimulant, things that we don't find to be dangerous in that sense. It is a spice. It's been used for centuries, so there's no worries with that. What we're saying more is just to make sure the effects continue. Where there's not an issue where, hey, this isn't working as good anymore. So it seems that you can take it continuously, but again, we don't know for sure because there hasn't been longer term studies on that. So we'd like to see that. And that pretty much covers all the questions we've had. Who can take it? It's anyone. That's one more we actually had. It's not gender specific, so anyone can use it.
And we would generally recommend 18 and older. It doesn't say anything.
Yeah. I mean, that being said, if you're, if you have a child that's 13 and they can't stop eating or something like that, I think the alternative of overeating versus this would be a better alternative. So I think you have to consider that as well. But obviously, you being a parent, make sure, or if you are 13, you're watching this, always we recommend, we actually have a video up on supplements for teens. It's always best to inform your parents and do your own research, no matter what we're talking about, whether it's supplements or anything else. Do your own research. You can check our videos, you can show those to your parents. We do all the research for you, but it's always good to do some yourself. Informed skepticism is always a good thing. So I hope we were able to cover all your questions, concerns on it. please feel free to post them in the comment section if you have other questions. We're happy to answer them. We appreciate you watching. You can also check us out at facebook.com/bestpricenutrition. Thank you.
Thank you.